Singapore's relaxing its COVID-19 safe management measures amid the Omicron wave that's subsiding and high vaccination rates. From next Tuesday, mask wearing outdoors will be optional. Group sizes will go up to 10 from the current 5. In line with this increase, groups of up to 10 fully vaccinated people will be allowed to dine in at F&B establishments. For smaller groups of up to 5 fully vaccinated people, no entry checks are needed. Up to 75% of employees who can work from home can return to their workplace. Capacity limits for large events will be raised to 75%. And no more vaccinated travel lanes. Singapore will reopen its borders to all fully vaccinated travellers from the 1st of April as a new vaccinated travel framework comes into effect. Entry approvals will not be needed.
Prime Minister Lee Hsien Loong says the easing of measures is a decisive move towards living with COVID-19. In a national address, Mr. Lee also says Singapore's daily infections are set to halve in about 3 weeks. Melissa Goh with this report.
PM Lee told the nation that Singapore has reached a major turning point in the fight against COVID-19. Most of the population is vaccinated, and with many exposed to the virus and recovered, the people have a stronger immunity. In easing restrictions, he says Singapore needs to balance the needs of the healthcare system and reviving the economy.
We must not place an impossible burden on the healthcare workers and endanger many COVID and non-COVID patients who urgently need treatment. At the same time, we must weigh the cost of stringent SMMs on businesses and the economy and their impact on children needing to learn, youths yearning to interact, families seeking to bond, and communities striving to connect.
Mr. Lee says the changes stop short of a complete opening up.
We are choosing to maintain our measured approach, which has served us well over the past 2 years. After this major step, we will wait a while to let the situation stabilize. If all goes well, we will ease up further.
Still, Mr. Lee adds that Singapore must be prepared for more twists and turns ahead. If more dangerous COVID-19 variants turn up, stepping back and tightening restrictions cannot be ruled out. But Mr. Lee also adds that Singapore knows how to keep people safe, such as through an additional booster jab or an updated vaccine.
Please take today's announcements in the right spirit. Resume more normal lives. Enjoy larger gatherings of family and friends. Go outdoors without masks or reunite with loved ones abroad. But do not throw all caution to the wind.
He says getting here was through collective effort, thanking healthcare workers who made tremendous sacrifices for Singapore to maintain a sense of normalcy the past 2 years. Mr. Lee added that the city has come a long way and is getting closer to the finish line.
Under the new vaccinated travel framework for air and sea travel, all fully vaccinated travellers and unvaccinated children aged 12 and below will be allowed to enter Singapore from the 1st of April. They will not need to quarantine or undergo rapid tests on arrival. Entry approvals will not be needed either. Gwyneth Till reports.
The point of this framework is to bring travel back to almost like what it was like before the pandemic. To make this happen, Singapore is reclassifying all regions of departure into 2 categories, general and restricted. Travellers must not have been in restricted places in the 7 days prior to leaving for Singapore. At the moment, there are no territories on this list, but it's there in case border measures are needed later as the pandemic evolves.
We must, as it were, preserve the muscle memory in our system by ensuring that we preserve our capacity to process passengers from restricted list countries at dedicated areas in the airport and to quickly stand up on-arrival testing and other public health measures at the airport and ferry terminals.
While quarantine and testing on arrival are no longer needed, pre-departure tests are still required within 2 days before leaving for Singapore. The government says it will review this by mid-April.
In time, we should be able to remove it too. And this is especially given that imported cases account for a very small percentage of total daily cases, and the vast majority of travelers recover very uneventfully.
Remote supervised rapid tests will also now be accepted as a pre-departure test, but that would only be for Singaporeans, permanent residents and long-term pass holders in regions where testing is not easily available. Gwyneth Teo, CNA, Singapore.
Singapore and Malaysia will also allow fully vaccinated travellers to cross the border from the 1st of April without needing quarantine or testing. This includes both pre-departure and on-arrival tests. Now, this will apply to all types of travellers and modes of transport. In a joint statement, Prime Minister Lee Hsien Loong and his Malaysian counterpart, Ismail Sabri Yaakob, said that they recognise the good progress both countries have made in vaccination and managing the COVID-19 pandemic. It also reflects the long-standing relations and people-to-people ties, as well as the strong cooperation that they've enjoyed throughout the pandemic. Singapore's Trade and Industry Ministry advises travellers not to rush to travel, though, if there is no urgent need to do so. This will allow smoother travel for those with essential needs, such as for employment or reuniting with their families. Both countries are also progressively restoring cross-border public bus services.
The option of wearing a mask outdoors, larger social gatherings and streamlined vaccination checks at F&B establishments. These are among the changes Singapore is making towards treating COVID-19 as endemic. Clara Lee with more.
2 years after mask wearing was made compulsory, Singaporeans can soon breathe a little easier. Come next Tuesday, masks are not required in outdoor settings, but people are encouraged to mask up in crowded areas. Individuals will still need to wear masks while indoors, such as in office buildings, shopping malls, and even coffee shops. Naturally ventilated void decks, bus stops, and walkways are considered outdoor areas. Health Minister Ong Ye Kung says this is a significant step towards living with COVID-19.
Today's announcement marks a pivoting, not a dismantling, of our COVID-related measures. We cannot abruptly dismantle all our measures because that means letting down our guard, and that will result in the virus coming back to impact us and hurt us.
Up to 10 people in a group can soon dine in at F&B establishments. That's double the current limit. 5 fully vaccinated persons will be able to dine together without entrance checks, but they are subjected to random spot checks. This move will ease the burden for hawker centres and coffee shops that may face difficulties cordoning off their premises. And after a 2-year hiatus, live performances will soon resume. Up to 10 unmasked performers can take the stage. The 10:30 p.m. curfew will be lifted for the sale and consumption of alcohol. But Mr. Gan Kim Yong, the co-chair of the COVID-19 Multi-Ministry Task Force, says everyone should continue to exercise personal responsibility.
We have not reached our destination yet. We may still see an increase in the number of cases following the easing. We may also see new variants emerging here or elsewhere. We will continue to monitor the situation closely, and if all goes well, we'll be in a position to further ease up on our measures.
Authorities are also looking into the resumption of nightlife businesses and will provide updates in the coming weeks.
Offering a second booster dose to at-risk groups and making more changes to the healthcare system to relieve patient loads. Now, these are just some of the steps Singapore is taking to safeguard people's health as the country eases COVID-19 measures. Sherlyn Sia tells us more.
Protecting at-risk groups from COVID-19 as Singapore resumes more activities. That's why a second booster shot will be offered to those aged 80 and above, those with chronic diseases and residents in aged care facilities like nursing homes. While not compulsory, the task force is strongly encouraging these groups to get it. That's as they remain vulnerable to severe COVID complications, and more data has shown that vaccine protection wanes over time. This extra shot should be taken 5 months after their first booster, and more details on the rollout will be announced later. But for healthy persons in younger age groups, there's no need for another booster for now.
These persons have better immune responses to vaccination and are at a lower risk for getting severe disease. Our local data shows that their protection against severe infection has been sustained after their third mRNA vaccination dose, and the degree of vaccine waning over time has not been as great as in the older populations. Their existing immune protection remains sufficient.
There'll also be a shift in how younger COVID cases will be managed. Patients aged 3 to 69 are currently allowed to recover at home. This will be expanded to children aged 1 to 2 from Friday. Local data has shown most children in this age group have mild symptoms and are able to recover safely in the community instead of at dedicated facilities. These moves come as hospital emergency departments remain strained with a current average of 2,500 daily cases.
Most of them have chronic illnesses that may not have had close medical follow-up over the past 2 years because everyone is just so preoccupied dealing with COVID-19. These are what we call BAU, or business as usual patients. And we now have a BAU debt that has to be repaid one way or another. The BAU debt has therefore become a separate, non-COVID related healthcare problem. We will need a longer-term structural response to address the problem of the BAU debt.
Beds and manpower which were previously reserved for COVID cases will now be used to meet such BAU needs. 3 nursing homes will open in April to serve older patients, while private hospitals will continue to help admit and manage stable non-COVID cases. There are also updates on treating COVID-19. The oral antiviral pill Paxlovid is now available at over 20 public and private clinics. It's been prescribed to a handful so far. The task force will monitor if this medication brings better health outcomes, such as preventing hospital admissions.
Selected groups of teachers and students in schools can now remove their masks during language and literacy lessons. The government says this will be the first step in plans to ease mask-wearing requirements in schools and better support children's learning and development needs.
The risks of COVID must be balanced against the risks to the long-term development of our children. With the update of our national COVID posture, MOE will similarly adjust our posture and SMMs to better support the learning needs of our students.
The Education Ministry and the Early Childhood Development Agency will begin easing the mask-wearing requirement from next Tuesday. This first phase will include students with hearing or speech-related developmental needs in MOE kindergartens, mainstream primary schools and special education schools after primary 4 or equivalent levels. Students in mainstream primary schools who are in learning and mother tongue support programs and the reading remediation program may also remove their masks. The second phase will allow all teachers to take their masks off during language and literacy classes for young children up to primary 2 levels. This would cover preschools, national schools, madrasas and SPED schools. There will be more information at a later date. And then moving forward, the Education Minister adds that schools will also be encouraged to re-establish and expand overseas connections so students can understand the world they live in. He says most children have been vaccinated and the government will continue to refine safe management measures to balance the learning needs of students.